Hello everyone. Imagine that you are a financial healthcare decision maker or a financial director in one healthcare entity and you have $1 million to improve public health. How would you decide where to spend this money? Would you invest in a new cancer therapy, for example, or a vaccination program, or perhaps in digital health technology that would reduce the hospital visits? Each of these interventions promises a benefit, but with limited resources, how can we compare their true value? The cost-benefit analysis enables us to do so. Unlike other forms of economic evaluation such as cost effectiveness or cost utility analysis, those may use natural health outcomes like life years gained or quality adjusted life years. Cost-benefit analysis goes one step further. It expresses both costs and benefits in financial terms. This allows decision makers to directly compare whether the benefits of an intervention outweighs its costs in a purely financial manner and financial language. In healthcare, cost-benefit analysis translates health outcomes such as reduced mortality, fewer hospitalization, or improved quality of life into their economic value. Let's say in dollars or any other currency. This enables the financial leaders in healthcare to calculate and say, for every dollar spent, how many dollars in benefit do we get back? For example, suppose a new screening program for colorectal cancer would cost $10 million, but it is expected to save $30 million by avoiding treatment costs and productivity gains. The benefit to cost ratio here is 3-to-1, meaning that every dollar spent yields $3 in benefit. And from a financial or economic standpoint, that's a strong justification to fund the program. So what are the key components of cost-benefit analysis? Number one, identifying all costs and benefits. And here, costs include direct medical costs such as drugs, diagnostics, and hospital stays, as well as indirect costs like loss of productivity or caregiver time. Benefits include everything from reduced disease burden to longer lifespan and even intangible factors like peace of mind. The second important component is to measure the costs and benefits in financial terms. And this is probably the most challenging part because while costs are often straightforward to quantify, benefits require some sort of conversion from health outcomes to financial terms. For example, how can you translate one saved life into a dollar saved? This is a big and sensitive issue, and we will discuss it later in this session. But for now, we can say that financial directors and economists use methods like human capital approach or willingness to pay threshold in order to estimate how much a life year or a health improvement is worth. So this is the role of the financial experts rather than healthcare professionals. I'm stressing on this. The third key component is to compare total costs and benefits. The results are usually expressed as a net benefit, which is the benefit minus the cost, or benefit cost ratio, like the example that we mentioned, benefits divided by costs. A ratio greater than 1 indicates that the intervention provides more benefit than it costs, making it economically attractive. So, ladies and gentlemen, the main benefit of cost-benefit analysis lies in its ability to support resource allocation decisions across different areas of healthcare. Because here, everything is translated into money, into financial values. So decision makers can compare investments in completely different programs, like, for example, comparing a vaccine versus a new diagnostic system on equal basis, financial basis. For instance, if a Ministry of Health in a country is deciding between investing in a nationwide diabetes prevention campaign or building a new hospital. The cost-benefit analysis helps to quantify which option provides the highest return of investment for the society or the country. Moreover, policymakers increasingly are using cost-benefit analysis to justify public spending on health interventions, not only to improve outcomes but to demonstrate economic sustainability. In today's constrained healthcare budget, this is important. Let's have another example and imagine this time a government evaluating a new influenza vaccination program for adults. The total cost of the program is estimated at 50 million US dollars. However, it is projected to prevent 1,000 deaths, reduce hospitalization by 20%, and save 200,000 work days annually. When these outcomes are monetized, considering productivity gains, avoiding medical expenses, and the statistical value of life, the total benefit is calculated at 120 million US dollars. That's a net benefit of 70 million US dollars and a benefit cost of 2.4. The benefit cost ratio of 2.4. This means that for every dollar spent, the program yields $2.4 in return, making it a highly cost-beneficial public health investment. As you can see, this is a purely financial exercise. So then, what are the challenges and limitations? Of course, cost-benefit analysis doesn't come without challenges. Assigning a monetary value to human life and health raises ethical and methodological questions. How much is a life saved worth? Does the value differ between countries, age groups, or income levels? These are very sensitive issues that require careful ethical consideration. Additionally, cost-benefit analysis can sometimes overlook equity and access, focusing alone on aggregate efficiency rather than who benefits most. A project that maximizes total economic return may still fail to address the unmet needs of vulnerable populations. Therefore, while cost-benefit analysis provides a clear economic lens or financial lens, it must always be interpreted within the broader context of public health values, equity, and ethical responsibility, which is integral to the health technology assessment framework. Let's elaborate more on this because this is important. As we said, cost-benefit analysis should not be used alone to inform the healthcare decisions. Why? Because cost-benefit analysis is a powerful economic tool, we agree. It should never be the only basis for the decision. It provides valuable insight into how efficiently resources are being used, and this helps policymakers and payers to determine whether the benefits of an intervention outweighs its costs in financial terms. But wait a second, healthcare is not a simple balance sheet. Behind every number there is a patient, a family, and a human history. So cost-benefit analysis simplifies decisions into financial terms, translating health outcomes, lives saved, or pain reduced into dollar values. This translations allows the comparison across different programs, we agree, but it also introduces a serious ethical dilemma. Can we truly place a financial value on a human life, dignity, and relief from suffering? When we assign a specific number to a life year or a health gain, we risk reducing human well-being to a commodity. Let's take an example. A new treatment that saves the lives of patients with a very rare condition or a very rare disease. They might not appear, these drugs may not be cost beneficial because the patient population is small and the cost per life saved is high. From an economic standpoint, it could be rejected. Yet, from an ethical and humanitarian perspective, denying treatment to such a vulnerable group simply because it is not financially efficient raises deep moral questions. This is why experts emphasize that cost-benefit analysis should be used alongside other frameworks that account for equity, fairness, and social justice. Economic efficiency is only one dimension of the healthcare value. Others include ethical acceptability, clinical effectiveness, social priorities, and patient perspectives. In practice, a balanced decision-making process might combine cost-benefit analysis with cost-effectiveness analysis, budget impact analysis, and qualitative ethical assessments to ensure that the chosen policy is both financially sound and morally responsible. That's to say, cost-benefit analysis can inform decisions but should never dictate them. It helps the decision makers to see financial picture clearly, but it must be interpreted through the lens of ethics, compassion, and social responsibility. At the end of the day, healthcare decisions are about people, not profits, and the ultimate goal is not just economic efficiency, but human well-being and justice. Let's now look at how cost-benefit analysis differs from budget impact analysis, which we discussed in our previous episode, and how both can be used in healthcare investment decisions. Let's approach it this way. Cost-benefit analysis asks if the investment worth it financially. It measures both costs and benefits in money-wise or money terms to see if the benefits outweigh the cost. On the other hand, budget impact analysis asks the question, can we afford it right now? It looks at how much money will actually be needed from the healthcare budget each year in a period of 1 to 5 years, as usual, and whether that money is available now or not. So cost-benefit analysis is about value for money, but budget impact analysis is about affordability and cash flow. If we wanted to apply how they work together, imagine a health authority deciding between two vaccination programs, let's say vaccine A and vaccine B, where vaccine A prevents more diseases and saves more money on the long run. But it's very expensive to implement this year. On the other hand, vaccine B provides fewer benefits overall, but it's cheaper to roll out now, immediately. In real health decision-making, both analyses are important, and they complement each other. The cost-benefit analysis will help decide if the investment makes economic sense overall, while the budget impact analysis will help to decide if the system can pay for it now. So a government or a payer may say, vaccine A gives a higher long-term benefits, but since our budget this year is limited, we can start with vaccine B and consider a plan to introduce vaccine A later. In other words, cost-benefit analysis helps to decide if an intervention makes economic sense. Budget impact analysis helps to decide if the system can pay for it. They complement each other, financial value versus affordability. So, ladies and gentlemen, to conclude this session, let me say that cost-benefit analysis in healthcare provides a structured and quantitative way to weigh interventions in terms of their economic efficiency. It helps governments, payers, and policymakers to make more informed decisions about how to allocate limited resources while maximizing public health gains. However, we must remember that healthcare is not about numbers, it's about people. And while the cost-benefit analysis provides valuable insights into financial efficiency, ethical and social dimensions should always guide the final decisions. Thank you for joining me today, and see you in the next episode.